Direct primary care benefits anybody who needs medical care, particularly if you actually have a medical issue that requires ongoing visits with your practitioner or ongoing prescription medications. But I think one of the greatest utilities of Pear'd program in general is with Medicare. With any direct primary care program, it is not insurance. So it does not cover a catastrophic condition because you are contracting with somebody to provide a defined set of benefits, not the carte blanche that you really need under a catastrophic medical illness that could clear out all of your savings. You do have to have insurance for that. What we can do here at Pear'd is to provide all of the primary care in a fashion that does not have barriers to entry so that you can get the care that you need to prevent the chronic illness. Now, with a model like direct primary care, it dovetails very nicely with Medicare. One of the greatest deficits of Medicare is they will not pay primary care providers for care. So it takes so long to get in to see a primary, and the primary is creating many barriers to access, as is Medicare, to make sure that there is not an overutilization of services. What we are doing in a direct primary care model, and Pear'd in particular, is making sure we're delivering services in the most efficient way to get primary care front and center to prevent chronic illness. Since the Medicare is really dependent upon secondary and tertiary illness is really what their focus is, and they really have advocated primary care and will not pay the primary care providers. So if you have a plan like direct primary care, like Pear'd, in conjunction with Medicare, you have catastrophic coverage from Medicare and you have 100% covered primary care. This dovetails very nicely because one of the main defects in direct primary care is it doesn't provide for that catastrophic piece, that medical insurance piece. In the same way that you would not drive around a $50,000 car uninsured because it could be a total loss, you have to have insurance over your body because that could be much more than $50,000. So you have to have catastrophic coverage. Medicare provides that catastrophic coverage. What they don't do well is primary care. Direct primary care fills that gap. So a direct primary care program with Medicare is seamless. First dollar coverage, secondary and tertiary care delivered through Medicare, and it is the greatest opportunity to produce health for you.